So I got into healthcare because early on in schooling, I was fortunate enough to have a family friend that I was able to work with and shadow. And he was a general surgeon here in the area, which is also, how I got into my field. But to be able to follow him around and watch him basically every minute of every day, helping people person to person, all day long, to have a career where you can just consistently to help people that are having issues or problems. I was, from the minute that I was with him, I was like, this is really what I want to do. If someone asked me what's the number one thing I can do to take care of myself, it would be to find a family physician who they really mesh and gel and click with, that takes the time to listen to their concerns, that is not in a rush and will really address, whatever their problems in life might be. They will have a good relationship also with specialists such as myself, where we can work well together, and we can interact so that we all work together as a team. And their family doctor really would be kind of the quarterback of their healthcare team, get them to the right people so that they get the right testing, the right screening. Preventing problems is much easier than trying to fix them after the fact, and a good family physician would help coordinate all of their care. The way I deal with a nervous patient, and probably more patients are nervous than are not, is to really slow down. It's not their job to understand what's going on. It's really my job to help them understand. Obviously, medicine and surgical problems are very complex. And so I think if you can help them to really understand what's going on and what the goal of the operation is, they tend to really not be as nervous. It's the unknown that really scares people. And so if you can help them to understand what's happening, that really tends to help them. And a less nervous patient typically does better with an operation or anything really with their treatment. We live on a small, kind of like a hobby farm outside of town. I have a wife and two children, two little girls, and so we spend a lot of our time taking care of the animals, outside chores, that kind of thing, which really is an alternate to medicine. So it gets me away from here, and the animals and the family are a breath of fresh air. In the hospital and in the office, we're inside most of the day. So in my free time, I like to do whatever I can to get out with the family.